Afternoon, everybody. We're now online, and thank you all for joining us for this afternoon's press conference. It's Friday the 26th of March already. Again, thank you for joining us. And as you know, apologies from our usual councillor panel members who, due to being now in the pre-election period, are unable to join us, but I hope obviously you will find that you've still got just as much information being provided, and as usual we will go through the format of having an introduction, some statements from the panel members, and then obviously take your questions from that were pre-submitted. If we do have time at the end, we will take some more. But if I can just introduce you to everybody who's on the panel. Obviously I'm Lucy Whiteman, Director of Public Health, and I'll be chairing today, but we do have Dr. Rosin Harris, who's one of my consultants in public health, who will talk you through this week's surveillance reports. I've got Deborah Needham, who's the Chief Executive of Kettering General Hospital, Anna Dorothy, who's the Deputy Director for the Northamptonshire COVID vaccination programme, and Assistant Chief Constable Pauline Sturman from Northamptonshire Police. And as always, we've got Paul Andrews present from the COVID school cell. So again, welcome, and we will start, if that's okay, with Rosin just talking us through this week's data.
Thanks, Lucy. And I think we can get the data pack on the screen. Excellent. So to take you through the first few slides before we get into the data, just around some of the changes that are expected according to the roadmap. Excellent, thank you. So the previous slide just showed, sorry, if we can go back to slide 4, that would be excellent, thank you. Perfect. So the changes coming in to play on Monday, essentially that the stay-at-home order is removed from Monday the 29th. And from then, 2 households or the rule of 6 outdoors will apply. So 2 households or 6 people are able to meet outdoors in public or private settings. If we can move forward to slide 5. Excellent. Just to remind you of some of the key messages. First of all, and I'm sure comms colleagues on the line can add if there are any questions on this. We have a new campaign in the run-up to Easter holidays, given that this is the last day of term, reminding or urging all residents to be good eggs over the Easter break. So it's all about how we can stay safe over the Easter holidays, including our campaign around take care in the open air, which just focuses on the practical things that people can do if they're meeting outside to reduce transmission as much as possible. So that's one of the key things, is even though we're heading into the Easter holidays and people might be really keen to take advantage of the ability to meet outdoors, we just urge people to do that as safely as possible, following that take care in the open air guidance, which will be publicised across media and social media. The second thing that we want to remind everyone is if you do qualify for vaccination and have not yet received one, please do book. We have Anna on today to talk about vaccination, so I'm sure we'll give more detail. That's a key message, is if you are eligible, please to take up your vaccination. And then finally, testing. So you'll be aware that anyone not able to work from home has been eligible for rapid lateral flow testing for the last couple of months, and that now anyone in regular contact with a child, so either parents or other adults who are in a childcare support bubble, are all eligible for twice weekly testing using the rapid lateral flow tests. And so we're really encouraging all of those people who fall into those categories to get tested twice a week and to continue getting tested over the Easter holidays. If we can move on to the next slide, please. Yeah, excellent. So this is just an example of our Take Care in the Open Air campaign. And the next slide. Excellent. Tells us a bit about the testing that's available across the county. So as I said, it's all adults that are unable to work from home and all adults that are in any of those childcare support bubbles or in regular contact with children who are eligible to go along to our community rapid testing sites. And we've got the list there of all the testing sites that are currently available. We've got a couple more coming online in the next few weeks that we'll keep you informed of. The other thing that's become available, so if for any reason you can't get to one of the sites regularly, if you turn up at any of those community-based testing sites, you can also pick up a home testing pack to keep you going for the next few weeks. So what we're encouraging people to do is to go along and get tested, and then after they've received their test, they can pick up some packs to go home with to get tested at home. The other sites, so particularly we're looking at childcare bubbles, those adults around supporting children can also access these home testing kits if they go to any of our symptomatic test sites. That's the sites, the PCR testing sites that you can go to if you have any symptoms. But that offer of click and collect is only available between certain hours. So if you go onto our NCC website or the .gov website and look for collection of LFT kits or rapid testing collection, any of those search terms should bring you to a map where you can see all of those symptomatic test sites that you can also collect home testing kits at. If we move on to the next slide. And just a reminder for everyone that all I've just been talking about is for people without symptoms. So we're encouraging people without symptoms to get tested because we know that around a third of people who are infectious may not have symptoms. If you do have symptoms, it's very important that you don't go to one of our rapid test sites and go to one of our symptomatic testing sites to get a PCR test. So you've got the link there to the website where you can book a slot for symptomatic testing. Just to emphasize again, it is really important if you do have symptoms not to go along to one of our asymptomatic test sites. And then next slide. Thank you. So coming on to the data. As you can see, and these are figures in the last week up to the cases up to 21st of March, which is the latest set of data that we have sort of verified, or that we're pretty certain of those figures, because data in the last 5 days are usually subject to change. You can see there have been 589 new cases of coronavirus in that week, the 15th to 21st of March. Which looks like it's plateaued essentially from the previous week, and the increase that we'd seen in the previous week. That sort of reflects the national picture. In fact, nationally over the last few weeks, we have continued to see a small decrease, or around a 4% decrease in cases. So yeah, we're not seeing that level of reduction in cases locally, and in fact it looks as though cases in some of our district and boroughs are continuing to increase. So for next week's surveillance report, there might be a further increase in cases there, but albeit a small amount. I think the key point to make here is that we are identifying more cases, undoubtedly, because we are testing far more people than we previously were. So from the 8th of March, we started testing hundreds of thousands of people more than we were testing pre-8th of March. So some of that plateau or increase in cases will be because we're finding more cases. However, nationally, that same increase in testing has happened across the country. So if across the country they're still seeing a reduction in cases despite that increase in testing, there is, I don't want us to rest on our laurels locally because we think, oh, it's just because we're testing so many more people. Yes, it absolutely is a bit of it, but I think we still need to be very careful about what's happening locally. If we move on to the next slide that shows rates across our district and boroughs. So as you'll see, as a county, that number of cases per week, so the just under 600 cases per week, is equivalent to a case rate per 100,000 population of 76.7, which is significantly higher than the national average of 56.5 cases per 100,000. But across the county, we've got quite a significant variation from down in South Northants, 23, that's among the lowest 20% of local authorities in the country, right up to Corby, which is at the top in terms of case rates in the county. So we're almost a little England in Northamptonshire, showing the variation of case rates across the county, which is why as a county average, we're higher, but not too different from the East Midlands average, which is around also around the 76 mark. If we look at what that relates to in terms of absolute numbers on the next slide, so in Corby, that high case rate is equivalent to about 130-ish new cases per week. Of those 130 our district and borough colleagues look through the profile of sort of age, gender, what kind of households those individuals live in, to try and identify as well as where they work, identify any patterns that we can pick up, or issues in particular areas in workplaces or in certain parts of the borough, so that we can act on that. So yeah, please be assured that that we're looking into those actual numbers, as well as just looking at the rates and patterns. Each of those cases will be looked into. There are some, as well as areas that have lower rates than Corby. For example, East Northants, lower case rate than Corby, and absolute numbers lower than Corby, but have seen an increase in cases from the previous week to the week up to the 21st of March, and similar position in Northampton. Those are relatively small increases. As I say, if you look at the trend of the last few weeks, it looks more like a plateau, but we still want to keep a close eye on that. And if we move to the next slide, and this graph illustrates, I guess, the amount of change that we've seen across comparing weeks to weeks. So whereas we've seen a slowing, if you look at the dip after the 28th of February, we saw that shows that we had a significant decrease week on week in cases, which slowly slowed down to the days around the 14th of March, where we've seen, if anything, an increase in case rates over the previous 7 days. Again, just that message that we're by no means out of the woods and need to be really careful. If we move on to the next slides. And as I say, this shows the longer term pattern, and that what I was describing in that look back over the last couple of weeks, that shows overall a plateau after the initial increase in cases in Corby. I think what's key here is the dashed line, which shows the Northamptonshire average, versus the dotted line, which is the national average. So even as a county, given that there are some areas in our county that have really low rates, we are still on average still at a higher rate than the England average, and haven't really brought our case rates down to meet that England average. So that's what we're focusing on trying to get to that position. It is somewhat reassuring that it looks like Corby is plateauing as well as some other areas, but given the relaxation in restrictions on Monday, that could all change. We just need to urge people to continue to be careful. If I can move on to the next couple of slides, and I won't go through the final 5 slides, but I want to just show the next 3 slides in particular. First of all, to focus on cases by age and gender, and just to note that in terms of absolute numbers, in the week up to 21st of March, the 30 to 39-year-old age groups were responsible for the highest number of cases in terms of those age groups, and actually the working age population is responsible for the majority of cases, while in terms of proportional increases, younger age groups have seen quite a jump in terms of increase from before the 8th of March onwards. In terms of absolute numbers, it's still relatively small compared to the working age population. And if we were to turn those into case rates according to the number of people in those age groups in the county, that 30 to 39-year-old age group would still be up there in terms of case rates, which is slightly different to the national picture. Also to note, in particular areas in the county as well, that the 60 to 69-year-old age group is increasing in some areas as well, something that we need to keep an eye on, because we know that 60 to 65-year-olds particularly will still be at work, and so are not sort of out of the woods in terms of potential exposures if they're not able to work from home. The next couple of slides I want to just run through are around hospitalizations and deaths. So I think one of the key things about our excellent uptake of vaccines in the at-risk groups locally in Northamptonshire is that hopefully, given that we're seeing a small increase in cases over the last few weeks, that should not translate into an increase in hospitalizations and then deaths. The whole purpose of our vaccination programme is to protect those most at risk of severe disease and death. And so we'll keep an eye on these figures, but I think it is very reassuring that despite our cases not reducing and if anything slightly increasing, we're still seeing a reduction in hospitalizations and we're still seeing a reduction in deaths. Obviously, there is a bit of a lag between case rates and then hospitalizations and then finally deaths. So we'll keep an eye out in the coming weeks, but early indications look like the vaccination programme is absolutely doing what it should be doing. And the next slide just is on deaths, just to run over those figures. As you'll see, it's very small numbers, but certainly county-wide, week on week, we are seeing reductions in deaths. You can see just a couple of our district and boroughs have seen an increase. That's either because it was 0 or 1 in the preceding week. So with small numbers, we are going to see sort of some fluctuations, but generally as a county trend, we're seeing deaths reduce. And those were all the slides that I want to focus on in terms of data updates. You'll receive the full pack, but I'll pause there for any questions or to go back to the panel.
Thank you, Rosin. So I think what we'll do is obviously continue with the panel introductions and then come to the questions. So Deborah, are you able to give us an update on the position of the acutes, please?
Yes, I am. Thank you, Lucy. So we continue to see a slow but steady improvement in the number of patients with COVID in both of our hospitals in the county. It's really good news, actually, and reflects the huge effort and sacrifice put in by so many of us during what has been quite a difficult time of lockdown. This week, we marked the year since the COVID-19 pandemic hit. And we've reflected on what this has meant and also what we all still need to do to stay safe. One thing that I personally reflected on was just how incredibly grateful I am to our staff for the work that they've done in order to support and care for those with COVID and keep other patients and staff safe. So, as I say, the number of patients at the hospitals has reduced, and today we have 36 patients who are COVID positive across both hospitals. But we've got to remember that this pandemic is not over. We've just seen the numbers, and local rates of the virus still remain high, especially in the north of the county. So we've still got our own part to play here to protect not just ourselves, but our family, our friends, and the patients within the hospitals. So this means continuing to stick to the lockdown rules, being always aware of hands, face and space, and limiting contact with others, except where you absolutely have to do, where it's essential to meet with others. So we've still got a long way to go. We mustn't let our guard down too soon, because if we do, we will see numbers rise again, and that inevitably will lead to more hospital admissions and further deaths. So my message this week to the public is, please do your best to stay safe, keep others safe, and let's stick to the rules. Thanks, Lucy.
Thank you, Deborah. Anna, do you want to give us an update on the current vaccination programme? I know it's going well and we're expanding it all the time, and we're focusing on some particular demographics at the moment. So if you're able just to give us a bit of an update.
Yeah, absolutely. Thank you, Lucy. So continue to make really great progress that we can hear is having a really positive impact on people and admissions to hospital and severity of illness. So that's really positive. So we've now administered at least one vaccine to just over 300,000 people in the county, which is well over half of our adult population, and really critically that's focused on our most vulnerable population. So we really have got the most important half first in terms of reducing the impact. There is enough vaccine available to be able to vaccinate everybody within the eligible cohorts. So we've heard about the supply issues, but we have got enough vaccine. We still have appointments. We still have opportunity for people within those cohorts to come forward. So if you're 50 or over, please book in. If you haven't heard from your GP by now, please contact them or go through the national booking system and get booked into the vaccination centre or community pharmacies that we've now got open as well. So we've got 3 more community-led pharmacy sites, 2 in Northampton and also 1 in Greens Norton over near Towcester. Again, another positive step in terms of improving access to services and to opportunities for people, creating some more choice there. It is important to be registered with a GP so we can really track the numbers, make sure we've got all the right information and putting the calls out to people. So if people aren't registered already, please get registered with a GP if you haven't already done so. And just thinking about some of those, like you say, some of the harder to reach groups. As people will know already, we ran a session at the Clare Street Mosque last Friday, which was really successful, and we've been asked to do some more work with the Muslim community, so we're just working that through. Already referenced some of the work around our homeless population as well, for example. So we're really trying to drill down into some of those harder to reach groups now to make sure everybody has the opportunity to get their vaccine. Just to touch on the statistics that we've shared more broadly as well. So as I've said, we've over 300,000 first doses given, and lots of second doses starting to go out now because we're hitting that kind of 12-week period. And then within our age cohorts, so our 80 pluses remain at around 98%. Our 75s to 79s are 100% thereabouts. 70 to 74s are 67%. 65s to 69s are 92%. Our 60s to 64s are 93%. 55s to 59s are 78%, and 50 to 54s are at around 56% now. But say that was the last published data, and we already know that we've had lots of people, certainly through the vaccination centre here in the last few days, and a lot more people booked in still. So we do have slots available. So just encouraging everyone to take those opportunities up, really. Thank you.
Brilliant, thank you, Anna. It's exceptional work that we've been able to complete. But obviously, as you say, people who may have been hesitant previously, they are able to, if they've already been part of one of those eligible cohorts, if they want to change their mind, they can get in contact and obviously then book on. So just, yes, making sure that people do recognise they have got a second chance if they wish to get more information and or come and get that vaccination. So Pauline, are you able to give us an update on compliance and all of the other police activity that's been happening, please?
Thank you, Lucy. So good afternoon, everybody. In relation to the last 7 days, we have issued 154 fixed penalty notices for breaches of COVID legislation. And in terms of the key reasons for why those tickets have been issued, a majority of those breaches have been when people have been participating in a gathering of more than 2 people in a private indoor dwelling. Now, obviously, we are moving forward to the legislation changes on Monday. And as we have done through all the period that we've been looking at COVID implications, we'll continue to flex our policing requirements based on the legislative changes and on the needs of the community. And again, we're geared up for that for next week, and that might come out in some of the questions that we get asked through this period as well, because we want to continue engaging with the community, explaining as well. And whilst the legislation that is there, we have been enforcing on the basis of the legislative requirements, we very much want to continue that engagement with the public. And we've been focusing patrols on, for example, open spaces, because we're moving towards the Easter weekend next week. So we will be having increased patrols next weekend to continue our engagement with the public, but tailoring our policing response based on the impacts and the changes of the legislation from Monday. So other than that, we have really seen good support from the community. They are helping themselves to stay safe, and we want our part in that to also be supportive and give guidance where necessary, if we can do so, particularly, as we say, in the open spaces. We've increased activity, for example, in and around schools, from a community confidence point of view, so they see us at key footfall times. But we're mindful of the changes that come in, and again, hopefully I'll cover off some of the questions that will no doubt be reflected in that as we go through the afternoon. Thank you.
Lovely, thank you, Pauline. Paul, should I just come to you at the top of the meeting as well? Is there anything that you want to say more broadly? I recognise we've got some questions about schools as well, but any key messages you want to just quickly convey before we move on to questions? We can't hear you, Paul.
Sorry, hand mute. Yeah, thanks, Lucy. Good afternoon, everyone. I think the key for me is schools have worked incredibly hard to stay COVID secure. And I think my plea would be to parents and childcare bubbles as we move forward, especially as things open up a little bit, to carry on that work and to get yourselves tested. We can't test younger children with lateral flow tests. It's not a good thing for them to have to undergo. So the best way that we can find out whether or not there's infection running through childcare bubbles and families and households is for the adults within that household to take responsibility and get themselves tested. Rosin set out earlier the ways that you can go about getting tested. It's much simpler now than it was even 2 weeks ago. So I would encourage everyone, all adults, to take responsibility, take that responsibility away from your children, and to get yourself tested twice a week. You can go along to a test site and be tested. You can collect tests from a test site, or you can even sign up and get tests delivered to your home. I'd encourage you all to do that. As an adult, it's not painful, it's not difficult. As a child, it's not that pleasant. As a young child, it's not that pleasant. So that's what I'd really ask. And as we move, I guess, into the period post the 29th, is to really consider what you can do to enable your child to stay at school after Easter. Because if we don't stick to the rules over the Easter holiday period, if we don't stop sleepovers, if we don't stop our children from playing together when they perhaps shouldn't, even though that's tempting, when children go back to school, more infection will come into school, and we will end up with children having to isolate, more education being missed. And it's not good for our children. We really need to get them back on track. So I think that's it. That's all I'd have to say, Lucy. Sorry, rambled on a little bit.
Not at all. Thank you very much. And I think, Paul, actually, just before we go on to the questions, you've hit the nail on the head. And obviously we have a pre-meet, don't we? And we talked about this really now is in the hands of the public. We very much feel that with the education, the comms, the engagement, the testing, you know, all of the COVID security work that each of the settings has done, we've given as much help almost as we possibly can, and it's now within people's gifts to keep safe. We've been doing this for a year. People know what those basic rules are, and although what we can do within some of the restrictions is changing, the basic premise of how we keep each other and ourselves safe isn't. That's been the same now for a year. People know what's right and what's wrong, and as you say, we're making, and central government are making, access to testing and things like that easier. So this now is about how we maintain what is going to be quite a delicate balance of risk going forward. We absolutely recognise we're going to have peaks and troughs of infection rates now, but we cannot allow infection rates to get to the point where we are seeing people with significant morbidity and mortality and pressure back onto our NHS services. And it's that fine balance that we've really got to take individually responsibility for. So on that note, I'll move on to the questions. I think Laura Coffey is our first question, please.
Hi, good afternoon. This question is for Deborah Needham. Deborah, you sent out a press release, or the press release was sent out regarding people not wearing face coverings at Kettering General Hospital. I just wondered whether staff are facing any abuse when they're approached. It's something that you have spoken about previously. And if when they are approaching people, what are some of the reasons people are giving for not wearing them? I also just wondered if I could get in a question with Pauline as well, please. It's just, what are the police going to be doing come Monday when the groups of 6 and 2 households are allowed, if you find that people are meeting in group, 2 households are meeting and it's, say, a group of 50 and they say it's 2 households? What powers do you have to control that, and what will you be doing to police that? Thank you.
Thank you, Laura. Deborah, shall we take that first one first?
Yeah, thanks, Lucy. So I've got to start by saying that most people who are attending the hospital are being really vigilant about wearing masks and maintaining social distancing, and they're doing their utmost as well to clean their hands regularly. I think it's probably important at this stage to just remind everybody that we have got a lot of patients who we had to postpone their operations and outpatient appointments at the start of the pandemic, and we are now trying to get those patients in and seen. So of course, activity through the hospital will absolutely start to increase. Now, we've noticed that a small number of people are occasionally forgetting to put the masks on, and they're having to be reminded, and that just means a little bit more extra work for our staff. So I'm not aware of any particularly difficult or confrontational incidents, but clearly this is about us all working together and thinking about each other, especially in that environment, because it's a hospital, patients are vulnerable to infection. So we've just got to be really vigilant, all of us. So the short answer to your question is no difficult issues that we've had to deal with, but just a reminder. Thank you.
Thank you, Deborah. And Pauline, are you able to take that second question?
Certainly. So thank you for the question. So again, whilst we look at it in a really straightforward point of view in terms of the legislation with being up to 6 people or 2 households, we go back to the points that we've reiterated already about we want people to be key themselves to keeping themselves safe, their community safe, and their families and friends as well. So we will engage with them. We will go to the open spaces because the pandemic doesn't end on Monday. It's a transitional phase. So we want people to think about how they continue to keep themselves safe and their community, and that would be certainly the initial angle that we would be taking in support of the legislation that we've worked within, and that supports the theme indeed that we have used all the way through. The legislation is there not about being punitive, but in support of us wanting people to keep themselves safe. So that would be our tone of policing that we would be looking at continuing with following on from next week.
Thank you, Pauline. And we've got based on a police response as well, please. Kevin, are you able to ask your question, please? Have we got Kevin Nichols?
Yeah, sorry, I'm desperately trying to find my mute button on a new laptop. I do apologise. Yes, I am here. Thank you. Yeah, I fear the answer is probably going to be much the same, but looking through the legislation and the guidance last night, we seem to be in this position we were some time ago, where there's nothing definite on how far you can go. It's mentioned about staying local and minimising travel, but at the same time, I think people are under the impression they can travel as far as they like to see friends and families. I just wonder what the police's view is going to be on this from Monday, particularly if people coming into Northamptonshire, are you likely to be hitting them with FPNs if they haven't got a good reason for being here?
Thank you. So, as you said, I know it might be a bit of duplication with what I've already answered, but with the changes in legislation and the easing of restriction, of course, with any legislative changes, that will naturally correlate to any changes of what we can and can't legally enforce from an FPN point of view in relation to any breaches of legislation. So we wouldn't, if the legislation changes, issue a ticket correlating to a previous legislative requirement. Now, travel in terms of distance, as you said, it's not mandated in the legislation, but in terms of the government advice, which has always been to try and stay local, it's about remembering why that is the case. It's to prevent the spread of the virus. So we would continue also in line with all the other advice that's given to urge people to be mindful of that, because the risks that are posed with people traveling on the road network for greater distances can pro rata increase with the more vehicles that are on the road, and the longer you're on the road, you're exposing yourselves to other risks, which inadvertently, if the worst happens on a road network, then puts pressure on the health service as well. So it's supporting the theme of what I've already answered there, Kevin. So it just in relation to the tone of policing next week and asking people to keep themselves safe.
Thank you.
Thank you, Kevin. So moving on to Alice Wilson from Northants Live. You've got a question for Anna, I think there, please, or a couple, in fact.
Yeah, thank you very much, Lucy. Just very quickly, one of the questions we wondered was, are doctors and nurses in Northamptonshire briefed to try and persuade their patients to have the COVID jab? And if so, how does that work? And secondly, more of an administrative question. Obviously, the county is moving into the new council system next week. Will this affect how COVID statistics are reported across the county? And will that have like an effect on how we view them? Thank you.
Hi, thank you very much for the question. So just to go to the first one around doctors being briefed to persuade people to have the vaccine. What we know is the COVID vaccine is absolutely safe, and we've heard today and certainly over the last few weeks how incredibly effective it is. So the role of both doctors and other clinicians who are working to vaccinate people is to educate, is to inform, is to answer any questions that individuals might have where they might be unsure or reluctant, rather than to persuade. So it really is about giving information, advice, and reassurance, and again with that focus on those eligible cohorts, so for the 50s or above, and so GPs are linking in with people obviously to make sure that those people can have their vaccination.
Thank you. And I think you've already covered off the second question, really, haven't you, with regards to numbers? So Roslyn, can I bring you in on the way that COVID statistics are going to be reported here on in?
So in terms of any of those national dashboards...
Oh, you're a little bit quiet. I don't know if you've moved your mic away from you.
Sorry. Yeah, in terms of those national dashboards and any available data that's going to be available on the .gov website, that will absolutely be reported according to the new council's geography. So there'll be a figure for West Northampton, a figure for North Northants, just as every other unitary has its data reported in that way. However, we know that that will mask a lot of variation, as we've just been through in the report, within those unitaries, and that's likely happening for other unitaries that are on that watch list as well, that they parts of those unitaries maybe should have been higher up on the watch list. But when you show an average for a wider area, it sort of masks that picture in smaller areas. So definitely locally within our team, and all of the statistics reports that we produce, the surveillance reports that we produce, we will continue to report on a smaller geography level, according to the old district and boroughs. But yeah, unfortunately, nationally and on the watch list, we will appear as West Northampton, North Northampton.
Thanks, Rosin. And we've talked about this at the pre-meet. We feel it's really important that we continue to report that way, assuming that we always get the data in a way that allows us to do so. I think, it will take, and we need to recognise that people will still regard themselves as belonging to Corby or belonging to Daventry for some time. It will take a little while for people to re-identify themselves with the new unitaries, but also for transparency, to allow comparison over time. I think it's really important that we do allow that reporting to remain as far as we can facilitate it. Moving on to Northants Telegraph and Alison Bagley, please.
Hello. I've got some Corby questions. Can you foresee a situation where Corby stays in lockdown and is left behind? What other measures would you consider, Lucy, to stop that from happening? How significant is the influence of Corby's high number of HMOs on the COVID rates? And I've been contacted by the sister of a Corby man in his 60s. He's got a long-term mental health condition. He's been offered the vaccine 16 miles away. He can't drive. His sister lives in Yorkshire. What advice do you have for this family? And I've also got a question about KGH and visiting. Visitors to KGH have no trouble accessing the building. You can walk around the corridors during the day and the evening. Yesterday, you've urged people to wear masks and stay away, but is allowing the free flow of people through the hospital an acceptable risk? And is it enough to expect people to police themselves?
Thank you, Alison. So Deborah, shall we come to you first on the KGH question, and then Rosin, I'll come to you on some of the Corby data, and Anna on the vaccination, if that's okay. So Deborah, please.
Yeah, thanks, Lucy. So I think the first thing is every person has got to take some responsibility in this. As an organisation, it's really difficult to lock down a site, and actually at Kettering we do lock down the majority of the areas in the evenings and overnight. Now, our staff have got to have access, and as I said earlier, we are starting to bring more people in for their routine appointments. But this is just about being sensible. So I think what we need is to make sure that if you've got a hospital appointment, you try and come on your own if you can. You attend at the time of your appointment, you don't come early and have to then wait. And we realise that some people do need support and supervision to come into hospital. But really, we would just discourage anybody from coming just as company, really, if they really don't need to. Which on occasions we do still see happening, and we are challenging when that happens. But really, the public have got to take some responsibility here as well.
Thank you, Deborah. And as you know, I wholeheartedly agree with you. We've tried to provide as much information as we talked about before, all of the tools now for people to really manage their own risk and the risk that they may pose to others in their community and their loved ones. And as Pauline has already mentioned, we're still seeing that most of the transmission is happening within households because people are not adhering to the rules, and there is only so much that any of us, myself included, the police can do when people are doing things behind closed doors. So yes, where we can, where we're out and about, we absolutely have to take that individual responsibility. I wholeheartedly support you on that. Rosin, are you happy to cover off some of the COVID cases? I'm more than happy to chip in if you need me.
Yeah, absolutely. And I think the first part of your question was around sort of thresholds and what the case rates need to be for Corby to be stuck in a lockdown position while the rest of the country is released. And the short answer to that is there are no fixed thresholds. The government's been really clear that there is no magic number. above which we change positions. But what's clear is that we'll look at a whole range of, or rather the national government will look at a whole range of indicators, including case rates, but also testing rates, positivity rates, hospitalisations, deaths, at each point before restrictions are eased, to make a judgment call on that. So the next point will be just prior to the 12th of April. So I think the answer to that will be, there's no magic number. We'll just have to see what the full picture is prior to the 12th of April to understand what's going to happen in Corby after the 12th. And yeah, looking at the sectors that you've mentioned, so retail and leisure and hospitality. I think the next part was around HMOs and how significant HMOs have been in driving case rates in Corby. So I can say, based on the, as I said earlier, we look at all the cases that have happened each week in a local area to look for patterns, and we've got no evidence based on the 130 cases in the last week, for example, that that HMOs are driving an increase in case rates amongst those cases at all. We do know that there are challenges around managing transmission in HMOs, just as with any other sort of busy households, and we've produced a lot of guidance to support busy households in terms of reducing transmission within the households, but nothing to point to that being a driver of recent case rate increases.
Thank you, Ross, and I appreciate you covering off all the bits I would normally. It's nice to be able to step back a bit. The one thing I will add, though, about the regs that have been published for the next steps, it is quite clear that the government want everybody to come out and take each step together. They don't want to have local tiering, but I'm sure the eagle-eyed of you who are more familiar with some of the regs will have noticed that they have allowed that flexibility should they need it. Obviously, everything that we can do locally to keep our case rates as low as possible means we are more likely to be able to move forward with everybody else. So, you know, I am clear, and central government is clear, we want to do this as a country, but they have afforded the flexibility should they need it. Right, Look East, Mike Cartwright, are you here, sir?
He's not, but I'm here, Lucy. It's Stuart from Look East. I mean, to be honest, it's a question that we've answered week on week, asked week on week, really. And so I guess it's a bit repetitive. So it's not my question. So apologies. But just about Corby, about the rates staying so high there, and you know why that message isn't getting through, and how frustrating is it for you as a public health team that it consistently still sits in the top three, at the top of the tier in terms of the rates per 100,000.
Ross, did you want to take that? Then
yeah,
at the end.
Yeah, thank you. I would like to, because first of all, I just want to thank not only our colleagues who work in Corby Borough Council, who work extraordinarily hard to make sure that case rates are kept as low as possible. They really do a heck of a lot of work week on week, and have been for the last year. So thanks to them, but also thanks to the people of Corby. So I don't want to talk about our frustration about case rates rising, because the vast majority of people in Corby are absolutely sticking to the rules and doing what they should be doing. And so I don't want to make it seem like that this is the majority of the population that are doing something wrong. Because yeah, thank you to those in Corby, and that there will be thousands of you who are doing everything that we need to do to keep case rates down. There are issues with case rates increasing, and we know that there are certain factors in Corby that make that more challenging. For example, you are less likely to want to get tested and take up our offer of testing if you feel that you're in a low paid job or have insecure employment, and you're worried about what will happen if you have to isolate for 2 weeks, or have any other concerns around that. And we know that more people in Corby than in other places around the country fall into that category. Equally, we know it's a really tight-knit community, and I'm from South Wales, not far from Merthyr, where it's another similar community, really tight-knit, and you live close to your mum, your aunties, your grandparents, and it is really, really hard to not mix households when you're such close families. So there's lots of factors. I can't begin to list all the factors that are likely to be driving this. But just to emphasize the point that the majority of people are doing all the right things and keeping to those restrictions. And if they weren't, I think we'd be seeing cases exponentially rising. So just to encourage those that are not quite there to keep getting tested, to get vaccinated, and to not go beyond the guidance.
Thank you very much.
Thank you, Ross. And indeed, I've been talking to Tom Perskilove this afternoon about those very messages that, really we have provided as many tools as within our gift at this point in time. And we've focused a lot of those efforts in Corby. So it is just encouraging people to utilise them. They're there to protect themselves and their work colleagues and their friends and family. So please, as you say, the more people we have engaging in those services, the more likely we are to be able to continue to keep cases low and be able to move forward. If we see exponential rises, we obviously do risk getting some of those additional freedoms back. So global media, who obviously submit questions and ask us to read them out. So Paul, there's one for the Schools League, please. So now that Public Health England shows COVID case rates are now highest in those aged 10 to 19 years of age, can a direct correlation be made in the return of schools, and what can be done in Northamptonshire to reduce that?
Yeah, thank you, Lucy. Thank you, Global Media, for the question. Good afternoon again, everyone. So I think, as Rosin said earlier, in Northamptonshire, 10 to 19-year-olds don't have the highest case rates. However, I do think there is a relationship between the increased COVID rates in this age group and the increased asymptomatic testing that's been rolled out after the 8th of March when schools fully reopened. I mean, just some figures for you. For Northamptonshire residents attending education settings, over 205,000 lateral flow tests have been taken since the 8th of March. Now, this testing is finding cases we wouldn't normally be aware of. And when you add in the symptomatic cases that we would have been aware of, and the fact that we've reopened education to everyone, I don't think it's really a surprise that we've seen an increase in case rates. I think it's an opportunity now for me to say, education settings have worked and will continue to work incredibly hard to stay COVID secure and implement testing. And all of that's at the same time that they've been delivering high quality education to our children and young people. And I think as a county, we owe our education settings and their staff from nurseries, childminders, all the way through to FE colleges, a huge thanks for their efforts so far this year. It's been an incredible effort. I'm really incredibly proud of all of them. In regard to what we should do about the increase, I think, as I said earlier, and I won't labour it again, but adults in households with children and childcare bubbles need to get tested regularly. That is the best mechanism to keep COVID out of schools. Because if an adult's positive, then the children within that household will be isolating, and so the infection is unlikely then to get taken into school. So I think that's really important. In addition, though, I think we all need to stick to the rules. Hands, face, space, and taking personal responsibility for our actions, especially after the 29th of March, when we see a relaxation. Like everyone here, I haven't seen many of the people that I love dearly for a long while, and the temptation to go and see them and give them a hug and all of that stuff is great, and I understand it. But I also understand the massive impact it's having on young people's lives because their education's being interrupted. So personally, I will resist the temptation to go and hug my mum that I've not seen for a year. And because I know that's the part I have to play to make sure the children and young people who are, I don't want to paraphrase someone I don't want to paraphrase, but the children and young people that we're all responsible for. We're the adults in this world, and we are responsible for bringing up and educating our children and young people. And if that means I can't hug my mum for another 3 months, that's what I'll do, because that's my responsibility. Sorry, that turned into a bit of a lecture and I didn't mean it to, but there we go. Thank you.
Not at all, Paul. And I have to be honest, I know how passionately you feel about this. And I think we all, as I've talked about earlier today, are at that point where we can really see that there is this really delicate balance of risk. We are seeing how much additional, detrimental damage is being done by a continued lockdown to children's education, as you quite rightly say, to our mental health, to our physical health, to people having to have delayed interventions through acute trusts. We recognise now that it's time to start stepping out of the restrictions, but we've got to do so safely, and we all have to take our role very seriously in that. And I'm going to be very cheeky, and it's a bit of a chairperson's prerogative, but Pauline, please add anything to this. But actually the question for you and I about, with the next roadmap step on Monday, easing some outdoor gatherings, limited outdoor household mixing, some outdoor sports, is this going to be disastrous for Corby with the town's high COVID rates? I don't think that's actually a question for you and I think that's a question for the residents of Corby. Because, as I said, we've done everything that we feel is physically within our means. We've educated, we've enforced where people haven't understood or been compliant and deliberately been non-compliant. We have provided testing facilities. All of the settings that are reopening have worked really hard to undertake risk assessments, to provide additional safety measures. Our employers are engaging in testing themselves, if not they're encouraging their employees to go to one of the 2 testing sites that we've opened. So I think the question as to whether it's going to be disastrous or not really lies, the power and the outcome lies within the behaviours and the responsibility that each individual Corby resident, and indeed every resident across Northamptonshire, will take over the next couple of weeks. Pauline, is there anything you want to add?
Supporting your comments really loosely in terms of next Monday, it's a transitional step. It's not an ending. It's just a next phase. So therefore, if there was a significant step change in everybody's behaviours, we all have the ability to control those behaviours and those choices, linking into both what you've just said and particularly Paul as well. And for the community in Corby and for the people there, the risk, isn't gone on Monday. It's how we work safely through that in terms of how they interact within the community. So I support the points that you've made there, Lucy.
Thank you, everybody. And I do just want to reiterate Roslyn's point, though, that we do recognise everybody is trying to do the right thing on the most part. And as I said, we're trying to provide those tools to make sure that they can mitigate those risks wherever possible. If anybody does have any questions, members of public, press, anybody else, then they obviously always can contact the NCC customer services team. We have our own public health inbox, as well as the schools cell having an inbox. So there's lots of routes in to get additional information if anybody isn't sure what they should be doing. But as I said, and I think everybody is very, very much aware of what they should be doing now and what they can do to help mitigate the risk. It's an exciting step on Monday. We want it to be a positive step on Monday. But as you say, Pauline, it's one on a long road, and we've got to make sure that we do this safely. There's literally 1 more minute. So if there is one additional question, I'm willing to take it if anybody does want to whip their hand up very quickly.
Sorry, I never got an answer about my Corby man who sisters in Yorkshire.
You absolutely didn't. I do apologise,
no worries,
Alison. Anna, that was a question about accessing vaccination. Are you happy to take that? Do you remember the question, or do you need Alison?
Absolutely. No, I believe I did. If it doesn't answer it, Alison, just come back to me. So I think just to stress, people may be invited, as your chaps described, to a place to have his vaccination, but there are choices. So that could be to a primary care site. That could be there's also the community pharmacies and the vaccination centre. I appreciate that's the distance from Northampton. But to potentially go back and look at the other choices. So to go through the national booking system to see if there's a local pharmacy site. We've got one in Corby that might be more accessible. But we also really recognise it is hard for certain groups, particularly people with learning disabilities and severe mental illness, to access some of our services, particularly in a way that they feel comfortable to do so. So we do have a focused piece of work going on to think about how we do that differently, and also help people to kind of, well, use the opportunities they've got already. So where they're already in contact with services, we're looking at whether we're able to kind of tag on to some of that with pop-up options and so on in the future. So we are scoping and considering some of that. But yeah, if he's struggling, I would advise him to contact his GP and really look at any other options. We want to make sure everybody has access to this vaccine.
Thank you very much.
Thank you.
Thank you, Alison, and apologies for not covering that previously. So it is just gone 4 o'clock. I will say a big thank you to everybody again for attending. Just a quick reminder, there isn't a conference or a surveillance report next Friday, as it is Easter, and as Rosin's encouraged everybody to do, please be a good egg and adhere to the rules, be sensible, apply some common sense, please, people. But, you know, enjoy what you are able to do safely. You've also had an email just outlining that we're moving to a slightly different format with the press conferences, so there'll be one every week prior to the next stage of the release of the lockdown, so to follow through on that roadmap. But if anybody obviously has any queries in the interim, to always contact our comms box as normal. But just to say a big thank you again, have a wonderful Easter, and we will see you on the other side. Please do keep